unless you're raising a question or are one of the presenters there. Any questions or points of reflection, please put in the chat. If you've got any technical issues, you can contact specialprojects@adph.org.uk. They'll probably put that in the chat imminently, so that people can get in contact with them. So just a little bit about the Association for Directors of Public Health, the ADPH. Our role is essentially to be the representative body for all the directors of the public health in all of the UK. It's not just England, it's the whole of the UK. And obviously there are policies that cover England or England and Wales and so on, but we cover the whole UK. We're an incredibly collaborative organisation, and we work in partnership with a whole range of other organisations and institutions to strengthen essentially the voice of public health in the public realm, in the political realm, and in the academic realm. We're hosting the knowledge exchange role within the Local Health and Global Profits project to link local government and public health practitioners with researchers. So, the Local Health and Global Profits part of Population Health Improvement UK is bringing academics from a whole range of institutions, and essentially with the ADPH, we're joining up the on-the-ground delivery and operation of public health with those researchers, so that we are learning from each other, and that practice is very clearly based on emerging evidence as we go on. The objectives of the webinar are to introduce the local health Local Health and Global Profits, I find that hard to say, project, and to help councils understand how they can bring the National Planning Policy Framework to life and better join up public health and planning. And the Healthy Places project that I lead, again, that's one of its aims, is that joining up of public health disciplines and planning disciplines in place. And our focus today is on the NPPF, which is clearly one of the tools that we have at our disposal to really cement that join up of thinking across our professional boundaries, and hopefully to realise better outcomes both in the built environment, spatial planning, and for health outcomes in our local councils, in our local places, with our local populations. So that's the aim of the webinar. I'm now going to hand over to Professor Anna Gilmore from the University of Bath. She's the director of the local health. I'm still LHGP. I should just say LHGP. That'll be easier. And she can explain that, and hopefully she can pronounce it better than I can this morning. So Anna, it's over to you. Thank you.
Brilliant. Thank you so much, Daryl. Can you see my slides? Yep. Okay, great. So guys, I know you really want to talk about planning, so I'm not going to take up very much of your time, but we just thought that this is our first ADPH and LHGP webinar, we thought it would be useful just to give you a brief introduction to LHGP, because its success really revolves on us working together. So a little bit about it. So our vision is really that we aim to address the upstream determinants of health with a particular focus on the commercial determinants. So you can't really disentangle commercial from economic or social or political, certainly not these days. But we have a particular focus on commercial determinants and doing that at local government level. And through that focus, what we want to do is drive improvements in health at scale and help reduce health inequities. And we stress this upstream element. That means different things to different people. But what we're trying to stress is really a deliberate move away from this sort of individual behaviour change focus that much of public health has been about over recent decades, towards more structural or population level interventions, which might involve anything from changing the environment through harnessing the National Planning Policy Framework, as we'll talk about today, to changing policy, for example, through marketing bans, a high carbon marketing ban, for example, or even further upstream to that, to changing the local economic framework. So one of the things we're particularly interested in is if we change the focus of a local economy from, driving growth as measured through GDP to, for example, driving well-being, and we can come back to how that's measured in a future webinar, you would actually end up making very different decisions, and it's likely that public health decisions would be much easier to make. So that's one of the things we want to explore. And what we're really also trying to do is try and create a sort of a network or a movement, if you like, of those interested in and seeking to address the commercial determinants of health. So we see this project not just about these, interventions, so on, but as a broader attempt to sort of galvanize awareness and action in this area. And of course, ultimately, to address the commercial determinants of health will also require national action. But really, that the innovation right now is happening at local level with you guys. And that's what we need to harness. And I think by harnessing that, we can in turn move towards the national level. So here are the project aims. So we're trying to identify potential actions, and we use the term actions to really mean different sorts of interventions of the type that I just talked about to address these upstream determinants, but also to address the facilitators and barriers to implementing those actions. And right now we've got one project, some of you may already have been interviewed on that, where we've been interviewing practitioners out on the front line about what are the barriers to planning changes? What are the barriers to getting advertising bans and so on in place? And when we've got the findings from that and there's another work package looking at what are the sort of actions we can take in this area. And I had a quick preview before this meeting, and there are actually quite a lot that are relevant to local planning, covering issues from transport infrastructure to urban agriculture. How do we develop the appropriate resources and support systems to help enable that change to implement those actions? And those support systems could be webinars like this, but it could be a toolkit for countering industry arguments. And it may also be about, for example, legal support. We do have a small budget for legal support because we know that planning can lead to legal challenges, for example. And through all of this, taking a comprehensive approach to evaluating these actions or interventions, both beforehand in a form of impact assessment, and here we're going to try and use just the traditional approach, but also see what an impact assessment would look like if we used a well-being approach. And then at the end, evaluate the whole programme. And in all of this, what is really key to us is this co-production, all of us working together and taking a systems approach, because commercial determinants is a real sort of messy area, and we feel we really need to harness this systems approach. And as I've touched on, aiming to build sustainable capacity so that this project has some lasting benefits. So a commercial determinants of health lens, and I'm not going to talk about the commercial determinants in any detail here, but it can help us understand how commercial actors and their products and their practices impact on health. And just this slide is trying to draw out some of the ways in which commercial practices impact on our environment. So their marketing and their supply chains obviously impact our built environment, as do their waste practices. And then we see reputation management practices with McDonald's sponsoring local schools. Their scientific and indeed their reputation management practices impact our information environment, because that not only are they producing misleading science, but then they claim that they're being good in terms of putting apps out to help you address a drinking problem, which in fact are full of misinformation. So we end up with these misinformation environments. And this influence is really important because it's increasingly inequitable. And here's just some of the work showing on the left clustering of unhealthy commodity outlets in Glasgow. And not only does that clustering increase with deprivation, but you tend to get these multiple outlets clustering in deprived areas. And across the whole of England, Public Health England showed in 2017, I think this data was, again, this linear relationship between fast food outlets and deprivation. So some of you have been harnessing planning rules to address this, to reduce outlet density. And there is some evidence now, not only does it reduce density, but actually it can help address obesity in children, particularly in those in the most deprived areas. But as this BMJ investigation at the top of this slide showed, this came out a couple of weeks ago, and I'm sure you've all seen it. This is not always straightforward because we have big, powerful commercial actors like McDonald's fighting against this, and doing so often with really highly misleading arguments, but also threatening legal action. And that can exert a chilling effect. It really puts people off taking action, in part because of the fear of expense. And many of the arguments that came out in that BMJ study actually were exactly the same arguments that we found that the food industry was using. This was when Transport for London introduced food advertising restrictions, and we did a piece of work on this a few years ago. And in fact, we now know through a whole body of different pieces of work and a systematic review bringing it together, that all of these unhealthy commodity industries actually use the same arguments when opposing policies. So one of the things we could help in this do to help in this area, if that's what would be helpful, and this is where the working together is really important, is perhaps develop toolkits on these types of arguments and how we can counter them. So a little bit about who we are and how we hope to work together. So obviously the project is working with you guys in local government. Then we've got 5 academic partners, some of whom have actually done a lot of work already on planning. So there's a group in here at the University of Bath who were part of another project, TRUDE, which is just finishing up. And that they've done a lot of other work on planning and bringing health into planning decisions. And then we've also got 5 NGO partners. As has already been touched on, within the Association of Directors of Public Health, we've got Laura, who's on here. So she's our full-time knowledge exchange post and will be playing a key role as the sort of point of contact and liaison point between the academics and yourselves. And some of you have already kindly agreed to be on our advisory group. The first meeting will be happening in mid-March. And then we hope further webinars and workshops will follow, depending on what you guys see as most useful. And then what we've got is we've got a coalition of ASH, Alcohol Health Alliance and Obesity Health Alliance that's come together to address the commercial determinants of health. And we're also funding an advocacy post situated within that coalition, actually based within ASH. And that's really trying to harness the skills that these guys have got in advocacy, policy advocacy, helping us, move forward policy decisions that industry contests, as we've touched on very briefly. And then we've also got another NGO, the Centre for Thriving Places. And at the heart of their work is this Thriving Places Index, which is just illustrated here. And I think they're going to run a webinar as well. They publish this data annually for all local authorities in England and Wales. And this is one of the measures that we think we can incorporate into a wellbeing framework. And it starts, if you look at what's involved in that, you start to see how if every decision in a place by political leaders, communities, businesses, the public sector was judged on its impacts on these issues, we would actually end up making very different decisions. So that's all I wanted to say, because I think we need to get on with the more important NPPF for the rest of the day. But if you want more information, you can scan the QR code and that will take you to the website, and there you can get sign up to the newsletter and hopefully get links on to how to follow us on LinkedIn and so on. So that's it for me. We'll hand over to the more important elements of today, and we're obviously happy to do any other webinars on any other topics to talk more about the grant if that's useful. Please let Laura know. Thank you.
Thank you very much, Anna. And I didn't actually give you the full introduction of talking about the posts you've held and things like that, but you covered most of it. But just say you were one of the founding directors of Tobacco Control Research Group and co-director for the Centre for 21st Century Public Health at the University of Bath, and that expertise of from tobacco, of understanding, if you like, that it's not just tobacco, that it is a commercial determinant of health. That learning, I know that journey in my public health career, I've been alongside you and seen that growth in our understanding. It used to be sort of 20 years ago that we'd have our eyes on what big tobacco companies were doing, and we wouldn't have our eye on alcohol, on gambling, on fast food and supermarkets and the wider food environment. And now we very firmly have, because we recognise all those corresponding factors that you introduced there around what makes a commercial determinant, what games they play in order to say they're healthy when they're not, and really what we're up against in public health, particularly at local level, when you're trying to do something for the benefit of your population and trying to create less harm that might occur, and someone else has got a team of barristers that they've just marched in from central office up against you in a licensing hearing or whatever. I've been there, believe me, it's pretty hard stuff. But thank you very much. I don't know whether you're able to stay for the whole webinar and field questions, because we'll take those at the end. And I recognise that obviously people are putting in a huge range of really helpful information and links in the chat. So thank you very much for that. We'll now move on to the revisions to the National Planning Policy Framework. This is going to be led by Michael Chang and Hannah Byrne. Michael's a chartered town planner, an honorary member of the Faculty of Public Health. He's worked on as part of housing, planning and environments for health team at OHID, and has led on spatial planning and health programme with responsibilities for policy development. Recently just moved from that post to a new post in NHS England. And Hannah is the policy lead for housing, planning and environments with OHID, and works specifically on policy related to food environments and the link between planning policy and health, and embedding health into the New Towns programme. So I'll now hand over to Michael and Hannah for their slides. Thank you.
Thank you. I'm going to kick us off this morning. Thanks so much for inviting us. We're going to talk to you about the planning system, the NPPF, what we've been up to nationally and what it means for local health. Michael is kindly driving the slides because I broke my shoulder on Saturday, so bear with me. But what we're going to run through, it's quite painful. What we're going to run through is kind of what is OHID, the context, the National Planning Policy Framework, the outcomes we're expecting from the policy changes, and then next steps and kind of horizon scanning before we go into Q&A. Next, please, Michael. Thank you. So just to introduce our team and kind of where we sit in the context of national policy making, our team is the Housing, Planning and Environments for Health team, which rolls off the tongue, and then the next bit gets worse. We're part of the Office for Health Improvement and Disparities, which itself is part of the Department of Health and Social Care. So we work to the Deputy Chief Medical Officer, Janelle DeGruchy, and to Minister Dalton, who is just a few weeks into her new role as the Minister for Public Health and Prevention. Our team works across government to address the social determinants of health related to the built and natural environment. So that spans air quality, natural environments to housing. And for this webinar, particularly spatial planning. Next, please, Michael. Thank you. So this government's ambition is to raise the healthiest generation of children ever, but we can only do this through the cross-government approach to tackling social determinants of health. So that includes access to healthier food and by creating healthier food environments. And this policy in particular is a good example of the cross-government working, because this isn't all from our team. We don't own the NPPF policy, so we've worked with our planning team, with the obesity team, which I think Sam's also on the line, and with the Ministry of Housing, Communities and Local Government, who actually own the NPPF. So as I'm sure you'll be familiar, 50% of the causes of ill health are driven by social, economic and environment conditions in which we were born, live and work. These are really wide ranging and can have a direct impact. So poor quality housing like damp and mould, or air pollution can negatively impact respiratory health, or the indirect impacts of health by enabling health behaviours. So health behaviours are largely influenced by how our neighbourhoods are designed. So if, for example, like limited access to green space or spaces for children to play, high availability of tobacco or alcohol products, and for this policy in particular, exposure to fast food outlets with limited healthy food options. the food environment can influence dietary choices, and proximity to fast food outlets can make it more convenient for individuals to access or choose less healthy options, potentially contributing to overconsumption of calories. But the causes of obesity are very complex, but the primary driver is the increasingly unhealthy food that we eat. Food purchased out of home tend to be high in calories, saturated fat, salt and sugar, and in larger portion sizes than meals are made at home. And online food outlet access is also massively increased, and this is further kind of exacerbated with greatest access being in the most deprived areas. But there's also evidence that inequalities in digital access have increased. Michael, can you flick to the next slide, please? Thank you. We know that our chances of accessing healthier foods depend strongly on where we live, and across the country, this and even in your kind of local area, we won't all have the same experience. Children living in less affluent areas see 5 times more fast food outlets on their high streets than more affluent areas. And for children living in more deprived areas, they're also over twice as likely to be living with obesity compared with the least deprived areas. When it comes back to schools, Bite Back, the arm of Jamie Oliver's organisation that campaigns for better regulation of the food industry, they published a report in December which showed that nearly 3,500 schools across the country now have a major food outlet within 400 metres. And that's 1,000 more schools than in 2015. This means that 1 in 7 schools has an outlet within its proximity. That's up from 1 in 10 in a decade. 1 in 10 a decade ago. So this has a huge influence on children's food choices. Michael, can I pass over to you to talk about the planning system?
Thank you. So the rest of the slide pack's looking at why we're looking at planning today and the National Planning Policy Framework for England. But for now, into the planning system, I think we need to figure out exactly where it fits within in this particular slide on the food environment side. You know, why we're looking at the planning system, not just licensing or reformulation and all the other kind of things that we're looking at currently. The planning system deals with land use and actually deals with land use in 2 different ways. One is quite strategic, looking at the planning of the land and neighborhoods over the next 15, 20 years, but also quite operational, legalistic, looking at planning permissions, appeals, etc. But you can't, have everything that you have in terms of advertising the premises without having planning permission in the first instance. Therefore, planning is a really important upstream lever, and that's why we're looking at planning and seeing planning as one of the kind of key, if you like, solutions for addressing healthy environments. So that's why getting planning in its place is really quite important to recognize, particularly in your agenda. I think one of the key things of the planning system is that, like Hannah was saying, this is for England only, and I'll go through, very briefly some of the other UK nations shortly. But the Ministry for Housing, Community and Local Governments holds the main lever for planning policy and housing in local governments, and therefore the role of the Department of Health and Social Care is different than if we hold the policy lever. So there's a lot of influence. We have to do evidence gathering and conversations that we have to have with MSCLG. Regardless, the most of the planning system is administered by local governments, many of you in the call, in preparing local plans and determining planning applications. And that's, being very, very clear, and that's, everyone understands their issues. As I said, local policies and local plans look ahead over the next at least 15 years. And I don't think anything that we have in the public health system looks that far ahead. And so therefore, the planning system, yes, we can look at appeals, but actually looking at local plans, site allocations and things like that is really just as important as some of the other things we're looking for. Local planning policies and decisions should be looking at the health needs of the population and supporting the delivery of local strategies to improve health. And it's been very clear in the National Planning Policy Framework for a number of years now, and I'll go through that later on. Unfortunately, public health, we're not a consultee in the planning process. It doesn't mean that we don't get consulted, but we don't get consulted automatically, unlike NHS England in planmaking. And therefore, many of you do have to kind of elbow your way through the system to be consulted in the first instance. Doesn't prevent you from getting involved, I should add. And there's been an ongoing debate, definitely in parliamentary committees around obesity and planning, whether the public health issues are material in the planning system, and we can debate that later on as well. So on that basis, I think, and I showed a few slides, headlines about the system, and I'm showing you a few others, looking at how a lot of other outlets, including gambling and other things, are being addressed through the planning system, both for good and for bad. For example, appeals are being won by obviously objectors and businesses, but also they are being lost. Councils winning them as well. So have to be very mindful that they are they are kind of two sides to the story rather than just the one side, because they are councils winning these appeals, and we need to learn from them as to how they are making their case properly and effectively to the planning inspectorate on some of these unhealthy or healthy outlets. So just looking at, just kind of before I go into the planning system on the NPPF in great detail, I think I'm quite keen that today's slides looking at broadly at the environment than just the food environment, because if you look at the commercial determinants definitions, it's about the role and the activities of the private sector as they impact public health, and it can be both positive and negative. And a lot of the kind of conversation we are having around commercial determinants are very negative, but actually we are seeing some things that are quite positive as well. With the housing developers providing, some good quality housing in places. But interestingly, there's a very similar conversation in the kind of housing sector around the role of developers and housing, house builders in this particular space. And we know that, house builders and developers are private entities, and therefore, their primary interest from this government commission review a long time ago, a few years ago, that house builders concern is to deliver profits now and the future. Anything around social value, public health issues are secondary to delivering profits, and they can be complementary rather than contradictory. And we know that that's something that the developers understand very, very well. If you are buying a home, renting a home, that whether the market there, the developments are very similar to how we market healthy developments. So, for example, looking at Redrow, they do have tweets about, okay, did you know that 95% of our homes are within walking distance of 100 meters of a public transport link? It's clearly, how we articulate active transport, active travel as well. But, from the private sector, they know how to market that. And we know from a lot of literature, primarily from the real estate industry, that, good quality housing, properly developed and located housing and homes do actually have a higher premium than not. So the first factor they're looking at property locating distances away from a station, a train station, you can see the values there are very, very different. Otherwise, they'll be exactly the same, but they're not. And we know that when we're renting and buying a home, if your home faces a park, it's going to cost more if you face the other way. So therefore, some of these issues we have to take into account. But developers can make a very, very positive a difference. So councils must give developers a very clear and consistent messaging and obviously policy framework to work within. And that's where I think local authorities can make a big difference around the commercial determinants of health, definitely around healthy homes and the kind of neighborhood environment. And so today we're looking at the national policy, and if you look at the planning system, you can map out the planning system fairly easily. It's all kind of set on regulations, so there are no surprises. You can know exactly where everything fits together in the system, in the legal system. And today we're looking at the national planning policy framework as a key focus. So there are other gateways to the planning system for public health, but today is just on national policy for now. And just to kind of add to my next slide, this is about the NPPF for England. In Scotland, you have National Planning Framework and the Scottish Planning Policy. In Wales, Planning Policy Wales. In Northern Ireland, you have the Strategic Planning Policy Statement, which are very similar to the NPPF. So I would say, if you work from the other nations, please refer to them and take the principles from today's presentation for England to your different systems. So the NPP is quite an important document because it's the first gateway to how we, view the planning system and create local plans. Obviously, making planning decisions because it is material. Everything in the NPPF is material. The aim of the planning system, the NPPF sets out is to achieve, if you like, mutually supporting objectives around economy, society and the environment, and they should be all balanced in a way. So it's not just about economic objectives, but about economic, social, and environmental objectives. So being very clear about that net gain approach rather than just achieving, one of the three. It's about achieving all three in a mutually supportive way. So the planning system, the NPPF has evolved over the years. The first one in 2012, and then obviously the latest one in December 2024, which we go into detail later on. And the results of the December 2024 NPPF, is really the kind of the results of a process of engagement between DHSC, MSCLG on a variety of policy issues, and I'll highlight the three shortly. But we know that stakeholders from academia, the NGOs, but also local authorities representing, by ADPH, have played a role in responding to the NPPF consultation last year. And therefore, what we have now is really a celebration, if you like, of everyone getting involved in it rather than just DHSC and MSCLG conversations. I should say, please, hold your, energy and save your energy for further reforms coming up shortly, because there'll be further changes or proposed changes to national policy happening in England, and therefore the NPPF is only one part of the bigger picture. And it's not the end of the journey. It's actually very much the beginning of the journey for planning reform for England. So I'm highlighting three changes here in a really brief way. And many of you will have read these words in great detail since December, so I won't go into them in great detail. But change number one, main paragraph 96, healthy lives. The highlighted bits are the new wording that were inserted into the December version. So I'll kind of read this out very, very briefly. So planning policies and decisions should aim to achieve healthy, inclusive, and safe places which, and those wording were there previous to December, enable and support healthy lives through both promoting good health and preventing ill health, especially where this would address identified local health and well-being needs and reduce health inequalities between the most and least deprived communities, for example, etc. And those wording were there previously as well. Now, the key things from the wording actually, in my view, isn't the yellow bits. They're useful. They strengthen the narrative about how the planning system can support healthy lives and reduce the health inequalities, but actually the ones in the middle, especially where this would address identified local health and well-being needs, which have been there actually for a good 10 years, is the operational bit of the NPPF for this paragraph. And this directly links to the joint strategic needs assessment that local councils are meant to be having. And that's about putting policies and decisions looking to the JSNA and the health needs of your population. And we know from research that council does that pretty poorly. Only about a third of councils link their policies to the JSNA. And so, be very mindful of, what the NPPF adds in the December version versus what you should be doing already in the previous NPPF. But that's the one key change that we managed to kind of secure with MSCLG, and that strengthens the health narrative for those working in the planning system. The next one, I know a lot of you have interest in the NPPF on the hot food takeaways policy. This is a new paragraph, paragraph 97 on hot food takeaways, which says local planning authorities should refuse planning applications for hot food takeaways and fast food outlets, within walking distance of schools, or in locations where there's evidence that a concentration of use will have an adverse impact on local health. So that's a completely new paragraph, which I think many of you will be getting to grips with, and we'll have some questions around it later on. Hot food takeaway is quite clear in planning terms. That's the consumption of hot food primarily off the premise. And fast food outlets, there is no planning definition for that, but you can refer to kind of published public health guidance on what that generally means, and that generally means the out-of-home food sector, as well as shops that sell food for takeaways, including chicken shops, pizza, burgers, etc. And we know there's been an ongoing and evolving influence on policy landscape. From I won't highlight a few things, but definitely since foresight on the obesity issues, there have been a lot of research, government policies, guidance, and other things published in the last 14 years or so that has led to the NPPF change. So it's not a sudden change. Everyone's been asking for the particular paragraph from NICE guidance in 2010, the PHE guidance, to a lot of research from Cambridge, Teesside, and others as well. So it's something that council have been asking for. It's been recommended by the public health system and the health system as well, and therefore we have the NPPF policy, which we should all try and make it work if we can. And so a lot of that, a lot of the kind of drivers for the new policy is actually the general election. Previous to that, we had no plans to introduce the new policy, but since the election, the results of the election, there's a lot of strong push to include that policy, and therefore we have this policy now that you have in the December 2024 version. And then finally, looking at the changes to health infrastructure, I think it's really quite key that we look at both prevention and the way that we access health infrastructure, and how that's reflected in the planning system. Paragraph 27 does give a stronger indication that health infrastructure, including hospitals and neighborhood health facilities, should be planned for with your health system partners in the local plans, in the plan making process. And then the other one, paragraph 101, again, under the promoting healthy and safe communities chapter, was looking at putting significant weight on decision making on infrastructure such as health and blue light, emergency services. So I think these are really quite important changes that to support the NHS and how that we sustain and help fund the NHS, through the planning system and housing delivery. So what do we expect from the policy? Nearly finished. So firstly, obviously, the policy took immediate effect from December 2012. So 2024, sorry. So many of you may have already been involved in applications and decisions on takeaways, and it'll be very interesting to hear from you exactly how the new NPPF has helped or not helped, or there was no change really in the way that it's been put forward to your planners. But generally speaking, the new changes, definitely on the paragraph 96, 97, do recognize planning as part of a whole systems, kind of cross-government in a way and cross-council approach to addressing your health needs and your health priorities set out in your joint health and wellbeing strategy, including obesity if you have that. It should hopefully increase your confidence in applying the policies and when developing your policies, as well as making planning decisions. It doesn't give a direct mandatory application of, say, the takeaways policy, but should give you a lot more backing in your decisions around helpful takeaways. Definitely on that particular policy area, be shifting the decision-making default from refusing outlets to refusing outlets, rather than from saying yes but no. But yet the default position is to say no. Definitely around schools, and that's pretty clear from the policy wording. The ultimate aim and the impact of the policy that we should see, this locally from research from Gateshead and other areas done by Cambridge, is to see decreasing numbers of takeaways around schools and different areas of deprivation, and ultimately leading to reductions in obesity prevalence. And it's pretty clear from evidence from the NIHR research from Cambridge and others that if you do have a policy in place that can result in those kind of impacts that we can see on health outcomes. And a health infrastructure, definitely making sure there's better accounts of health infrastructure needs of society when you're making those planning decisions and making local plans. So just final slide, looking at the next steps. I think, like I said earlier, save your energy for things coming forward, because a lot of things we have no control over, but there are things that you can feed into, like the NPPF consultation last year. Most of you have fed into that, and therefore the strength of the response is really quite important to see how we can improve on policy. So firstly, we'll be expecting further local plan making reform shortly, or at least a consultation, looking at how you streamline and shorten and simplify local plan content. Some councils have 600 pages of local plans, which is way too long. So government wants to reduce the scope, if you like, of local plans. SPDs will no longer exist. Supplementary plans will be instead, what council will have to produce and going through light touch examination. And then details will come in further regulations and guidance. So please look out for those, as well as public consultation on some of these proposals. On devolution, I won't go through this in great detail, but we're expecting the forthcoming devolution bill. But the white paper last year was very clear about how we, plan across local authorities on different issues around housing, transport, but does introduce health improvement duty to the strategic authorities, and how do you implement that? In groups of local authorities is remain to be seen. And then finally, if those two things on devolution, playmaking are too abstract for you, you can get involved in quite site-specific initiatives. So new town programs, there'll be around 10 of them across the country, major developments of at least 10,000 homes each. So these are quite massive neighborhoods. They'll be created across the country. Healthy and safe communities is a key principle from a published statement from the New Towns Task Force, I think last week. And look out for the sites. They'll be announced in the spring 2025. So if the sites are in your area, definitely try and get involved in them and help include healthy and safe communities in the developments of those master plans and decisions. So in general, please, do think about how forthcoming reforms, will impact on your ability to operate and influence planning at the local level, how you may want to be involved in this, and this where ADPH can play a key role and help corral responses and get views and feedback to MSCLG and DHSC. And obviously, ultimately, when these reforms are embedded, how do you make them work? And we can be supporting you on that if you need to. So any further information, please see those links, which circulate the slides afterwards, and please email us if you have any questions. And finally, any kind of Q&As, I'd be really interested to hear your general comments on the NPPF as a whole. These are the three main changes that we've included, but actually there are a lot of other things in the NPPF that should be discussed as well, rather than just those three health policies. And then what more could be done for health as part of the wider planning reforms. Thank you, Daryl.
Thank you very much, Michael, and thank you, Hannah, for a very comprehensive run through of that. So we've got about 15 minutes for questions. We've already seen a couple in the chat, but it's not a question, it's an observation. Yeah, I'm sure many places are looking forward to designation of sites for new towns. I still think that there's work to be done, some of which could be done through planning policy, but has to be done through other means as well around existing towns. In my patch in East Sussex, because of the landscape protections and risk of flooding and so on, very, very unlikely we're going to have a designated new town site anywhere in the county. But we do know that many of our existing towns, particularly coastal towns, with a lot of Victorian and Edwardian kind of guest house infrastructure, we need to retrofit that better for healthy lives as individual housing units, but we also need to retrofit the transport systems, the infrastructure around those towns, the town centres, the businesses, the shop units, the leisure uses, the tourist uses, and all things so on. So anyone with the ear of ministers and the DCMO, etc., a plea for thinking about existing towns and retrofitting. And it's not just same old regeneration that's required. It's a spatial, at the scale of the new towns way of thinking about this. And if there were a call for sites, then I would certainly be wanting to put a couple of our towns forward for that, because to have some support to do that well would be very much a good piece of learning for other people. Anyway, that's my hobby horse. I shall stand off that now, and I'm going to ask you to raise hands for questions, but I'm going to pick on two people already. Andrew Ashcroft of Lancashire County Council and Lucy Moffat have already highlighted this concern we have about hot food takeaways being a designated planning class, and fast food outlets having no legal definition, and about the difficulties that people may face there about how local planning authorities are going to determine what's a fast food outlet, and the fact that we could end up with every local planning authority having a different definition is a worry, because that's not going to help us with the barristers of the large corporations. So I don't know, Andrew or Lucy, if you want to say anything more to that, but I saw your queries in the chat, and they really resonated with some of the thinking that I had. So anything. Andrew, your hand's up, so
Yeah,
let's come to you.
No, thanks for picking up on that. And I must say, I do understand the reason for broadening it out, because we used to get quite a bit of challenge that hot food takeaways was quite, a restricted and defined thing, quite narrow. So understand the reasons for broadening it out, but I think Darryl sort of explained some of the challenges with that, which we're going to try and unpick locally. But any advice would be welcome. Thank you.
Michael, Anna, any comments?
I mean, if others have views, please do chip in as well. Because I'm not suggesting that I have all the answers. But what I should say is, firstly, the baseline hot food takeaways will be addressed by the policy. So that's what we've been calling for years, and now you have it. So at least for those applications, is stronger, clearer, direction about those things. I understand the fast food outlets issue, and actually, for those of you who know me for a few years on this particular area, I've tried to avoid the term fast food outlets because, as many of you know, there's no plain definition for it. But, there's a wider issue around how politicians and others see fast food in general, because if you mentioned McDonald's and, some of the kind of fast food chains, you start explaining to them as a planner that actually they're not takeaways when they clearly are, takeaways in the general layperson sense. So I guess the policy gives councils the discretion that they never had before to address, the outlets that are not hot food takeaways. So if they are, restaurants with, a good takeaway elements, you can possibly, address those now with the policy, but a lot of it will still be down to how you evidence, those things as well. So I don't have an answer to your question. All I can say is it gives you the opportunity to tackle the issue that you never had before. It does bring challenges, as many of you are saying, Darryl is saying, inconsistency of application across the country. But we can work with you and others to try and come to an interpretation.
Thanks very much, Michael. Yeah, that's brilliant. Darius Pragnell from Oxfordshire. How do we support planners in their understanding of what walking distance from schools should be? Darius, do you want to add anything else to that, or have you got an example?
No, not particularly. Just that I note that it says walking distance from schools in the wording, but actually it doesn't say how far that is. So I've seen in plans examples of a 5-minute walk from a school. Obviously, that's quite subjective. So we would be wanting to see a measured distance, and 400 metres is obviously flagged up quite a lot. So it was just, how do we make that a general thing that people adopt?
Yeah, I think that's really helpful. And I'm going to also go to Jennifer Hamilton. I don't know where you're from, Jennifer, but you've raised the issue of the goal of people walking. 15-minute walk to green space is not a requirement and doesn't seem to be talked about much more. You're in the kind of 15-minute neighbourhood territory there, which we know misinformation led to all sorts of conspiracy theories about that concept, which has been a concept of spatial planning since Ebenezer Howard and the Garden Cities, essentially. How people could think that was something to do with conspiracies to keep people under control, I don't know. But again, now you've got a thing there about it. That's a 15-minute walk. So you've got a timed walk, and you've also, as Darius says, you've got a walk that's set out in the distance. So with different ways of seeing these things, which may cause confusion and may require us to define them better in our local statements. Jennifer, I don't know whether you wanted to add anything about that. I'm not hearing a response there, so I'm going to take that as either you've got a sticky unmute button or you don't want to say anything more on that. But thank you for raising the point there. Any hands up questions? I'm trying to keep up with the chat as well as keep an eye on the hands up.
Darryl, just to say, I think Rich responding to Jennifer is a really important point. I think definitely around the takeaways and some of the other policy issues, it should be down to local authorities to determine the numerical distance. I don't think, at least in the NPPF anyway, it will be appropriate for us to specify a distance, because I know councils have different distances, and if you're in rural areas, it's very different to an urban area. So that's why I think walking distance is a good general indication for councils to bring forward a more specific measure around walking distance in their local policies.
Yeah, and you know, Rich also talks about health and wellbeing strategies, about having a potential to have another health and wellbeing strategies, JSNAs. Those documents that we have in public health at our disposal can add weight to our planning policies by having the right concepts and the right aims within them. So thanks, Rich. That's a very useful point that you've raised there. And sorry, Jennifer, you're having connection problems, so that's why you couldn't come in there. So further questions or points, people, or anything that people want to add?
I've got a quick question.
There is, yeah.
It's actually a question someone else has asked. I think it's Holly Rawlings, was around the designation of town centres. So she said,
yes,
consultation response around a designated town centre. Does a local centre fall under that reference? I think that was her question, which could be quite difficult to manage, because obviously there's lots of local centres.
Yeah, absolutely. And also, there might be new local centres that are developed by, new out of town facilities that might receive those kind of definitions, and that's where a number of kind of fast food outlets, drive-throughs, etc., are going. Because of the sheer weight of use of those places, they may adopt those kind of town centre principles by default. So anything that Michael or Hannah you want to add on that point about local centres?
I'm just typing the chat, and I'll say this out loud as well. I think the reason why town centres were not included, it's not to say the policy does not apply. It's basically to kind of suggest that the NPPF and local policies already have quite strong town centre policies, and they generally try to avoid over-concentration and proliferation of the same uses along the same frontage. So in town centre locations, yes, there wouldn't be, the presumption against takeaways because they're not around schools. Even they do overlap, then in that case, town centre policy will kick in. So I would suggest that in those situations, the town centre policies will be more likely to be the main reasons for refusing or approving takeaways than the NPPF.
Thanks very much. So I see we've got two final questions, Will Harrison and Angela Hutton. So let's go to those. We've got 4 minutes left before we wrap up. So over to you, Will.
Hi there, I'm Will. I'm from North Tyneside Council. I'm a Planning Policy Officer. I think it was more just a comment. I mean, we adopted our local plan in 2017, and we had a hot food takeaway spatial management zone, kind of very much influenced by the pioneers of Gateshead and our neighbours Newcastle. And we very much, the success of our policy has been that we've never lost an appeal for a new hot food takeaway, which is, it's a great success. However, I think something that we're trying to kind of navigate is very much the use class. So very much McDonald's, Burger King, whatever have it, these massive big corporations are maybe classed as a restaurant, in which there's no spatial management policy that that we have, or pretty much any of our kind of local authority would have, because it would be classed as a restaurant. But then again, the argument is, if the takeaway is ancillary, kind of the drive-through, I mean, that's a whole another story as well, the whole drive-through element. But if the takeaway element is ancillary to that unit, which then opens up a whole another, is it then, are they then properly hot food takeaways? Because we all know the service of a McDonald's is you can rather fit in or you can take away. But obviously the takeaway element is like it's still a consumption of poor food choices. And I think another thing would be, because we're working towards a new local plan, or if we can at all, how planning can kind of transcend that online access to poor food choices. So Just Eat, because now it's not just people ordering food within North Tyneside to the house, it's people who are ordering food in North Tyneside from Newcastle city centre. So therefore that completely just blurs the boundaries between the two authorities. So I think it's got very much just a point of interest there.
Thanks very much, Will, and thanks for bringing up that issue of the online ordering. Again, a commercial determinant of health, very much in evidence there. Completely new business model of getting, essentially, crap to people fast, with even less nutritional value because it's generally cold and claggy by the time it gets there. But there's a business model in it. People are racking up massive profits in that business model, and it circumvents an awful lot of planning, and particularly where you have the dark kitchens, sort of the faceless industrial units that are turning out food for a number of different providers. Do they count in planning terms as a fast food, etc., etc.? Can you use your very successful in North Tyneside approach for those places? So thanks for bringing that up, Angela. Final question from you, please. Final
Thank
point.
you.
Sorry, again, it was just a comment, really. It was just that, so the example that I've given in the chat is that we have, it's a fast food restaurant application with a drive-through. It's within a town centre designated area, but with 3 primary schools within 400 metres. So, so the town centre designation, looks likely to override that, but that takes us back to the commercial determinants of health issues. And shouldn't that protection around schools that's in the NPPF take precedence in a situation like that? I mean, I don't think we've had one where 3 schools are within a designated area before.
Yeah, thank you, Angela. I think a very specific case study there on what takes precedence, the planning framework around the particular space, or the closeness to those 3 primary schools. So we wish you well with that. So I need to now bring this webinar to a close, and I'm not going to attempt to summarise, because I think we've had a range of very, very in-depth presentations and some really insightful questions and comments and examples of excellent local practice. Can I thank the speakers, Anna, Hannah and Michael, for their time. Thank you all for attending and being so engaged on the issue. Any sort of further follow-up, people might want to put comments in the chat, and people also sign up to, there's should be a link in the chat for the newsletter, so people will be kept up to date on forthcoming webinars. So again, thanks to the speakers. This area of work, spatial planning and health, and now sort of like wrapping that up with thinking about the commercial determinants of health, this is really powerful stuff for us to create change in our local places, and to recognise, as the NPPF now does, the huge link between these issues and how we address the inequalities we see in our places. When people map these things, when people map fast food takeaways, gambling premises, etc., there is always that overlap between the spatial arrangement of them and the spatial arrangement of deprivation. And by talking today, by answering questions today, and by supporting each other through the adoption and the opportunities by the NPPF, I think we're in a more powerful position than ever before to make a difference. And of course, Anna and her team are still working on further evidence and further research to support us in this practical practice. So thank you all. I wish you all the best, and I'm sure our paths will cross sometime soon. Thank you very much. Bye bye.
Thank you, Daryl. Thank you, everyone.
Oh, thanks very much, of course, to Laura and the ADPH team. I forgot them, because they've obviously made this happen behind the scenes. So thank you to them. Cheers all. Thank you.
Bye.